Hello and welcome to Digital Medboard. Here we go. The transversalis fascia forms the posterior wall of the inguinal canal and contains an entrance called the deep inguinal ring. The testis travels through this ring, followed by the spermatic cord, which travels through the inguinal canal to reach the testis. The relationship of the spermatic cord determines the relationship of the inguinal canal. The external oblique muscle forms the anterior wall of the inguinal canal, has an exit opening called the superficial inguinal ring. The internal oblique muscle consists of arching fibers that first appear anterior to the spermatic cord. As they continue, they form the roof and then extends posterior to the spermatic cord. Similarly, the transversus abdominis muscle, which also has an arching fibers, is initially lateral to the inguinal canal. It then forms the roof before extending posteriorly. Since the transversus abdominis muscle is lateral at first, it does not contribute to any wall of the inguinal canal until it forms the roof. The internal oblique and transversus abdominis muscles together contribute to the posterior wall by forming the conjoint tendon. These two muscles also contribute to the roof of the inguinal canal. The anterior wall is formed by the contributions from both external oblique and internal oblique muscles. Medial to the deep inguinal ring, the inferior epigastric artery is present. This artery arises from the external iliac artery, which itself branches from the common iliac artery, originating from the abdominal aorta. The position of the intestine relative to this region determines type of inguinal hernia. If the intestine enters through the deep inguinal ring, it is an indirect inguinal hernia, commonly seen in young individuals due to congenital defects. If the intestine protrudes medially through a weakened conjoint tendon, it is an direct inguinal hernia, occurring in elderly individuals due to muscle weakness. We got a question. The fibers of the internal oblique and transversus abdominis contribute to which wall of the inguinal canal? This is a controversial question. Based on our discussion, the fibers of the internal oblique and transversus abdominis are arching fibers that contribute to both the roof and the posterior wall. However, they together form the conjoint tendon in the posterior wall. Since the question specifically asks about the fibers of the muscle and not the tendon, the correct answer is option C, roof. That's the end of the session. If you found this video helpful, don't forget to like, share and subscribe to Digital Medboard. Got questions? Drop them in the comments below. See you in the next video. Until then, stay tuned. Choose.